All right, you are on air on Pal Radio 96.9. Karibu sana. Why don't you just introduce yourself?
Yeah, my name is Zaina Bisaji.
Right.
I'm a medical practitioner practicing, and at the same time I've done my law today, so I'm doing both the things. In the morning I do my medical practitioner, see my patients. In the afternoon I attend to the office in the law court.
Wow, you mean you double up as a medical practitioner in the morning, and then in the evening you are also a lawyer?
Yeah.
Wow. Allow us to just applaud you for that. That is such a, that's a huge feat, man. You're not someone to joke with, Daktari.
No, you can joke with me. I'm quite friendly in that way,
All right, asante sana. Then, of course, we have also in studio an amazing gentleman and a lady. We're going to start with the lady, of course, Yvonne, who actually shares a name with our 10 a.m. host of the show Pal Play with Yvonne. She's called Yvonne Kenya. Introduce yourself, my dear.
My name is Yvonne Bae.
Yes.
I work with the judiciary as the head of ICT support services.
Right.
Yeah.
ICT support services.
Yes.
What does that entail?
It entails supporting the registries and the court operations.
Okay.
Yes.
Fantastic. And of course, Mr. Martin Karibu sana.
Asante.
Yes, jitambulishe.
My name is Martin Jagongo.
Right.
I work at, by the way, we are from the judiciary.
All right.
Me and Yvonne
Yes.
work as a court assistant.
Right.
At Milimani Law Courts.
Right.
And I have served the judiciary for some time.
Right.
For about 13 years now.
Wow. Okay.
And my work is generally to support the judicial officers, the judges, and the magistrates. I also have some little qualification in law.
Yes.
Which I have studied in the course of my being in the judiciary.
Right.
So I may make also some observations on issues to do with law and constitutionalism.
Okay,
Yes.
fantastic. So KITUO cha SHERIA, you're all part of the KITUO cha SHERIA?
No, we are from the judiciary.
Okay,
I think
from the judiciary.
Daktari comes from KITUO cha
Daktari, why don't you
SHERIA.
just tell us a bit about KITUO cha SHERIA?
Well, KITUO cha SHERIA, I just joined about last year.
Yes.
And, I joined after getting in touch with Madam Menet.
Yes.
And requested her that I should join him, and she's agreed to it. So I'm at the moment to Korea, and I just attend in the afternoon. I go over there.
Yes.
And clients and see if they need some assistance and all that.
Oh, right.
Like last year, so I'm just about still new in KITUO cha SHERIA.
All right. I hear you're very conversant with matters COVID-19 and everything that pertains to it. But there's a question that was, that was raised, and especially from, our listeners this morning, and of course from Monday, where the CS actually told us that we'll need to provide proof of vaccination in order to access government services and to even do travels within the country and without and outside the country. And it elicited a lot of mixed reactions. Maybe you can shed some light on what exactly that is all about.
Yeah, you see what has happened now since the rules and regulations have been relaxed and curfew and everything, and the uptake of the vaccine is very low in our country. So that's why the ministry has come up with this idea, this regulation that everybody who has taken vaccine should carry the certificate with them. And it's quite a right thing to do, because it's the government, the people, the society is really not taking keen interest on taking this vaccine.
Right.
Bring about that the population is fully vaccinated and we are able to control the pandemic in our country. I think the right solution and the right regulation which has come up, so that at least we will be able to come to know that how many people have been vaccinated so far also. Like, for example, yesterday in the news, they said that in counties like Mandera, the uptake of the vaccine is only about 1.4%.
Wow.
Very little.
That's low.
That will also help us and the government and the society to combat this pandemic as fast as possible. All
right. Do you think that the lifting of the ban of the curfew has actually stunted the efforts of the government to keep this COVID-19 at bay?
Well, in this situation, in such a situation, there is pros and cons about this.
Yes.
It may help reduce, it may help. It may reduce the efforts of the government,
right.
But at the meantime, they've come up with the regulations where you are not supposed to be moving around without a mask.
Right.
You should be washing your hands regularly. Use sanitization, social distancing. The other things also should be reduced also. So
Yes.
lifting of the ban, and more so, they had to lift the ban because we are economically going down. People were still complaining about it. The efforts they are trying to do is still going on. They are still on. The efforts are there.
Yes.
It may or may not, efforts of government to keep the COVID at bay. And this is only by coming up with the efforts of keeping washing. What I'm to say is using the directives of washing hands, social distancing.
Yes.
It's still on.
Right.
That's my point. So this vaccination certificate is also a good step forward
Right.
on the part of the government.
Right.
So they are able to curtail this pandemic, and at least that mass vaccination keeps on going on.
All right. We're going to be back with you, Dr. Zainab Esagi. We're going to be asking about the vaccines. There are so many vaccines in town, and you can think about that as I talk to these wonderful people here. We're going to be right back. And all right. So you can think about the vaccines as we ask this question. You are, in the judiciary, and therefore, so much. I just want to know, in matters law and the rights of Kenyans, is there a situation that would call for, like maybe in a pandemic, where the government can decide that my rights can be put at rest kidogo, because you see now you can't access government services, which are actually the right of every Kenyan to access government services. So is there a law that actually supports this fact that we can they can deny us to access these laws without having, maybe it's what they're calling about the vaccine certificate?
This is my legal opinion.
Yes.
This is not the stand of the judiciary.
Right.
And it is in our constitution.
Right.
You can limit rights.
Okay. Or limit. That's the word.
Yeah, we have a provision for limitation of rights.
Right.
And in a reasonable way and by law. If the government would come up with regulations or some laws that they can use to limit people's rights and for justifiable reasons.
Right.
And I believe vaccination can be a justifiable reason.
Okay.
This is it is strict. I mean, it is within the law.
Right.
But we are not sure if there is already a law in place or some regulations. You remember when we were going into quarantine and social distancing, the government came up with some rules and some laws that were to be implemented by the police. And you saw the police arresting people and arraigning them in court for not wearing their masks properly. So if this is anchored in law, then the government is home and dry.
Yes.
They are right. But just to stress that COVID-19 is still here and it is dangerous to everyone. This, I think it's a myth that the young people of my age and below are safe.
Yes, true.
I mean, it needs to be busted.
That's
so that people know it's dangerous to everyone, and people needs to. The only way that we know that can prevent it is through vaccination.
Fantastic.
And people should go for it. My only other concern is when government now tells people that you need to go for vaccination before you access services. Then the government should be very ready to have vaccines.
Right.
I'm not sure if we have enough vaccines
to go for everyone.
I'm not sure. Maybe the government should address that so that when finally we start to stampede going for vaccines, they should be there.
All right, and Kenyans, we know what happens. Last minute,
everyone will be on the queue trying to get a vaccine.
Yeah.
And maybe you can just shed some light on how COVID-19 has affected the judicial services, because now the judiciary is trying to go digital or is going digital. And of course, I believe it's in a bid to, in regards to how COVID happened, and now we cannot have in-person court proceedings and all that. So how has COVID, probably we don't know because we're on the surface, but but maybe as for you can just shed some light on how COVID-19 has affected judicial operations.
Yeah, maybe Yvonne can do
course,
that. Yes.
Of course, last year when
Yes.
when the government, the president decided we are now on lockdown. So we had to come up with solutions to make sure access to justice is realized.
That's right.
And this is where judiciary decided that we'll have to embrace virtual hearings. And with that, at least, because in law we know it's a hearing must be open.
That's right.
In an open environment.
Right.
But you see, with the virtual aspect, somebody will keep on and wondering, is really a virtual space, is it really open? Is it really for certain people who are people in social society who are at least have some money, they have internet, they have equipment? Yes, judiciary has been affected, but it is both positive and negative.
Right.
I'll talk of the positive aspect. With it, we've seen a lot of cases being dealt with.
Right.
I'll take an example in the commercial and tax division. From last year around January to this year around June, there were around 500 tax appeal cases that were filed.
Right.
Which was translating to about around 115 billion.
Wow.
So from that period, you can imagine, had we closed our courts,
the backlog would have been crazy.
that is backlog.
Yes.
And then also issues of money, releasing money back to the economy.
The economy, yes, yes.
It would have affected.
Right.
But now that we introduced the virtual hearings, the virtual sessions, at least 57 of those cases.
Wow.
That translated to around 11 billion.
Right.
So you can imagine,
Yes.
to around 112
Yes.
billion to now 11 billion was released back to the economy.
Okay.
So that is one positive impact.
Right.
The other one of the negative impacts, of course, if you are in a place that you don't have equipment,
Exactly.
courts are locked, your cases will not proceed.
Wow.
So we've tried as judiciary in most of our court stations. One, recently we recruited ICT officers
Right.
to help us at least with the automation process in most of these courts. We've transferred them to some of the courts that we really saw that needed a lot of support.
Right.
We also established a customer care desk in those stations.
Right.
So at least you'll get into a court, you get a customer care desk there.
Right.
They'll assist you with filing. They'll also assist you with the virtual court hearing. On the same breath, we've also procured equipment.
Right.
So this equipment is for use both internally for the staff and also for the people who are coming to visit the station.
That's right.
Yes.
All right. That's quite informative. Of course, as the head of ICT Support Services, Directorate of the ICT, the Judiciary. And of course, we want to ask Daktari to talk about the vaccines. The diversity of the vaccines. We've heard about AstraZeneca, we've heard about Moderna, Johnson & Johnson, all these vaccines. And Kenyans are like, we don't even understand which one we should go for. Is there one that is preferred? Why are they so various, vast? What should I do? Why do others have 2 injections, other ones have 1? You know, maybe you can give us a brief rush through about what the vaccine is all about.
Yeah, you know what vaccines? There are about 5 or 6 types of vaccines.
Right.
Which have been approved. The first one is Oxford's AstraZeneca, which is a viral vaccine, which is genetically modified little virus, and they are stored at the degree of around 2 to 8 degrees for 6 months. Another is Moderna. This is a genetically modified substance in the laboratory.
That's right.
And needs a very low temperatures for storage, and you can store it for 7 months, and that is between minus 25 to 15 degrees.
Right.
The third one is Pfizer. Again, the same messenger RNA, which is genetically modified in the laboratory. Again, 2 doses are supposed to be given. And the storage again is around 80 to minus 80 to 60 degrees, and you can store it up to 6 months.
Right.
There's another vaccine, Sputnik, which was in Russia, and probably it was brought over here in Kenya, and it was banned later on because it did not fulfill the Ministry of Health regulations.
Right.
There is also another viral vector, which is, a weakened virus, but not the same of the COVID, but another virus. And again, there's another 2 doses. that also has to be stored.
Yes.
Now, it comes in a powder form. This Sputnik comes in a powder form.
Yes.
We have to dilute it with water.
Right.
And when it is in a dry form, you store it between 2 to 8 degrees centigrade. But it is in a liquid form. It has to be stored at minus 18.5 degrees.
Right.
Okay? And another is a Sinovac. Again, inactivated virus, which is weakened virus. Again, 2 doses. And stored between 2 to 8 degrees.
Right.
Johnson and Johnson virus, Johnson and Johnson vaccine is another viral vector vaccine, which is a weakened virus, but not of the same virus of COVID, but different virus.
Right.
And it's a single dose, and it's stored between 2 to 8 degrees, and the storage is for almost 3 months.
Right.
Now, Novavax is a protein-based virus, again, 2 doses. And stored between 2 to 8 degrees. Now, all these vaccines are all the same. They have the same efficacy, they have the same effect, everything.
Yes.
The only difference between Moderna and Pfizer is that these are laboratory prepared.
Okay.
This is genetically prepared.
Right.
Not contain any viral material in it. It is genetically prepared in the laboratory. Probably because of that, people prefer Moderna and Pfizer because they think that they will not, because other vaccines they think they are going to get another infection because they are weakened viruses. They may be the disease of that viral infection.
Right.
But in the case, all these vaccines are properly prepared. They go through all the processes, research activities, everything. They even go to the Food and Drug Association, and they are quite safe and effective.
All right. Wow.
Yeah.
Thank you so much for that information. We're going to be right back. We want to take a short break. And when we come back, we want to discuss about vaccine apathy, why the myths that surround these vaccines and why Kenyans are, like very hesitant, like what we have seen in our counterparts in the Americas, very hesitant to take this vaccine. So we'll be right back, Daktari. So, all right.
Pal in the morning it is, with me, Jonik.
And me, Danko Atalaku. And of course, on call we have... We have Daktari. We're going to be right back. And of course, in studio, we have...
Yvonne Bai from the judiciary.
Right.
And Martin Jagongo.
Can you hear me, Daktari? Hello. Can you hear me, Daktari?
Yeah, I can hear you.
Ah, fantastic. We wanted you to introduce yourself, the way we introduce ourselves as presenters.
Sorry?
We wanted you to introduce yourself again the way we introduce ourselves as presenters.
Okay, you want me to introduce myself again?
Yes.
Okay. My name is Zainab Isagi. I'm a medical practitioner.
Right.
I've done my law, so I practice medicine in the morning. I'm supposed to be seeing patients at the moment.
Yes.
But I'm still with you now over here for another 15-20 minutes or so. And
all right.
in the afternoon, I do law practices, and I'm with KITUO SHERIA. So I'm part of KITUO SHERIA.
Asante. All right, fantastic. And of course, this is Pal Radio 96.9, the home of Fresh and Classic. You can catch all the action on our social media handles, Pal Radio KE. Follow all the action. If you have any question, the number to call is 0701 969 969. Digitization of the judiciary as well as COVID-19 vaccine. I've forgotten the
COVID vaccine 19 myths.
Yes. We're talking about the apathy. Why is there not a huge uptake on getting this vaccine? Is it that the Wananchis don't have information? There is no civic education that has been done on this vaccine, or why is there such a big apathy on the same?
Yeah, you see now, probably there is lack of awareness in educating the vaccine, what vaccines are actually. That could be one of the reasons why. Okay? Secondly, it could be because population or the people fear the effects, the side effects that they are going to get. Because at one time, it was heard in Europe that somebody got a vaccine and developed thrombocytopenia, that means less platelets, and started having clots, but which is not true.
Okay.
That case was even analyzed and found, examined and re-examined, and found that probably that patient had other comorbidities.
Yes.
So unfortunately, when he got that vaccine, and it's not because of the vaccine that he got these clots. He already had some comorbidities with that, They said, and this is the reason why he got this thing. That's one of the reasons.
Right.
And the other reason is mainly creating awareness and educating people, saying that this vaccine is quite safe. It does not cause any side effects. It needs education and counseling, one of the things. And if this doesn't help, then obviously the government has to come up with regulations, mandatory, making it vaccine to be available, because that is the only way we'll be able to curtail this pandemic.
All right.
Mass vaccination will only help us to curtail the pandemic. Okay, we take our regulations are there, social distancing, but how much can we abide to this? People don't really look into it. Like, for example, if you see now in TV media,
yes,
you find mass crowds not having anything. They are just closely entangled among themselves. There's no social distancing, no mask, no hand sanitation, washing, sanitation. So the main thing is need to create awareness among the society.
Create awareness.
Awareness, educating them, counseling them. And if that doesn't help, then obviously the government has to take drastic actions of making it mandatory. Like now it has happened, like it was mentioned in the media saying that people will have to carry the certificates of vaccination. And if they don't have it, they will not be
able to
given
access
to the services.
Right.
Now, mind you, this is person to person, but you can access services either through mobile, through WhatsApp, and all other media you can use. But in person, you need to have your vaccination certificate.
All right. You've talked about mass education, civic education. Just educating the masses. What are some of the what would be best? What is your idea on how we best do this?
Mass education, like educating in mosques, barazas, churches. Right. Education in school, school education, children should be given awareness. And as it is now, vaccination will be rolled out for children between 15 and 18 years old, and that will start from school.
Right.
Only it was in the media that will start from next year, and it will start from the school. So they have to educate the school children also from now on, so they get aware of it. But one thing is there has to be a consent from the parents for vaccinating children. Okay.
All right. Thank you so much. We'll be right back with you. Let's get into matters judiciary in just a moment.
Yeah. Okay.
And my question is, you've talked about, Yvonne, you told us about, the measures that the judiciary has taken to ensure digitization has taken effect. And of course, you've told us one case that has really has been the impact or the key. We can talk about the case study here of how it has, helped in, affecting this change. But what are some of the measures that you've taken internally? Because you're talking about having gadgets in the centers, etc. So internally about the staff, the judiciary staff that's supposed to help the common mwananchi, access these services. What has been done to make sure that they are up to par?
Okay. Thank you for that. One of the things that we've done is we've done training.
Right.
Training, continuous training that is ongoing.
Right.
That is to the judges, magistrates, and also the staff. We also have identified trainers of trainers amongst those people.
TOTs.
Yes. So you'll find if, for instance, a staff will see my fellow staff is also a trainer. That is an encouragement. So they know next time if I do something good, I'll be identified.
Right.
Number two, we've also procured equipment for our staff. Laptops for the judges. We've procured speech to text to help them in judgment and rulings.
Right.
We also have bandwidth, increased internet bandwidth.
Right.
Like in most of the urban courts or what we call the high courts, we have double internet. One is the primary, the other one is the secondary.
Backup.
Yes, at least when one is off, the other one is up.
Is up and running, yes.
Also, we have power. Alternate power. So in the event power is off, we can have another one that is coming.
Wow.
In the northern frontier counties, we have plans to harvest solar. So that is one aspect. Rather than having generators each and every place, we have also solar which we can use.
That's right.
Yes.
So do you have the financial muscle? Because of course this has very critical financial implications.
Yes. Apart from the government giving us the allocations that we get annually, we also have development partners who are coming in. So development partners come in training, that is one. They're also coming in to give us some equipment in terms of donations. Yes. Besides also the buildings that you are seeing.
The buildings, yes.
All right. So we are also being equipped in fact with education. Yes.
All right. Yeah. So what is the opinion of the other stakeholders within who are you working with other than people in the judiciary? Of course, we know one of them you've mentioned is people who internet ISPs. Yes. So who other stakeholders or people that you've partnered with to ensure that this has been effected?
Okay, I'll give for instance in the criminal justice sector.
Right.
We have, apart from the people who come to court, that is the advocates, the ODPP and the state agencies, we also have Safaricom. They are giving us a payment platform and our banker KCB also. Right. So those ones we are using them interchangeably. So in the event, for instance, you're coming to file a case, you'll not leave there and then we tell you go to the bank. You have your phone. You can just pay everything for the fees. So everything is one-stop shop.
One-stop shop.
Yes.
Okay. I know you're in the ICT.
Yeah.
Now, this guy of commercial and tax, I want to know, how have you interacted with this system and how have you seen it? Because it's very easy for her because, she's ICT.
Yeah.
Her job is to make sure that this has been effected. But have you interacted with the system itself? As an advocate, as a lawyer, and also part of the judiciary?
Without the ICT system, that is the e-filing and the case tracking system that has been put in place. Actually, in the commercial and tax division, we have had it since 2018, even before COVID.
All right.
So without it, if the system was down today, then I have no work. That is how far digitization
you have interacted.
Yes. It is so integral that if the system is down right now, the number of calls that would be coming into my phone from advocates, from people who are trying to file, would be so overwhelming that my phone would be off by noon.
Give us a scenario, for example.
So let me right now, we have a twin system kind of for filing in the judiciary. So what I interact with is what is facing me, the internal interface is the case tracking system.
Right.
So when an advocate files in the integrated system, which is on the other side, which is e-filing system, I see the documents from my side immediately. And you see, it's a process, it's done in such a way that when the advocate is done uploading immediately, the system gives them an invoice and tells them this is how much you're supposed to pay.
Real time.
For the court fees. And immediately they pay, the document is on record, and for purposes of urgent applications, there are cases where someone may want to file an application that they may want to be placed before the judge immediately.
Okay.
Now the system has been done in such a way, kudos to ICT, they have really implemented what we wanted. The court processes are implemented, they have been automated in a good way, so that when it's urgent, you file, for example, an application under certificate of urgency, the system picks it up and brings it to my dashboard. And at the same time, the judge is notified. Actually, it assigns it to the judge immediately. So the judge can simply just log into the system, type the directions, and publish them. Immediately it's published, the advocate who filed and plus the other parties, they will see it with immediate effect. So it has really revolutionized everything. And I don't think, there are people who may still, technology is so disruptive.
Yes, it is.
And some people have found it disruptive. They have found it, they have interfered, it has interfered with their way of doing things. There are people who have been coming to Milimani filing hard copies. So this issue about sitting and facing your desktop the whole day and filing, they don't find it, but I find it so convenient, and everyone who uses it should find it convenient.
Actually, I was about to ask, like with the in-person, right now we're allowed to have in-person meetings and all that, and of course we are accustomed to the in-person court hearing, like you go in person, but now are people embracing the digital more than the in-person, or do you have space where if you'd like to come in person, that's okay, if you'd like to go the digital way, that's okay?
Well, we are operating a hybrid system right now. There are cases that you can't. Now, I have talked about the registry processes. Now, we also have virtual courts. Right. Our courts take place on Teams and other platforms. So there are cases where probably the case is coming for a hearing, and evidence needs to be produced, especially if they are hard copy evidences, and bearing in mind that the Evidence Act requires that we produce originals or certified copies. So that document, you can still as well upload it in the system, but you still need to produce the original. So in such cases, the judges mostly will order for an in-person hearing, a physical court sitting. But for filing, for purposes of filing, I will give a very good example of an affidavit of service.
Right.
Like I sue you, or and I serve you. I need to serve you and prove that I served you with the court papers. The proof of service is an affidavit of service. That's and remember, the case will not proceed without that affidavit of service. It's just probably a one-page document. And someone has to travel from, say, Kiambu, come to Milimani to file an affidavit of service, which costs in our court fee 75 shillings.
Wow. Right
now it's free. Initially it was 75 shillings. Right now it's free. So you come all the way from Kiambu to file. The affidavit of service is 75 bob. You have spent more than 75 bob, and you have spent time.
Yes.
So why would you want to come to the registry to file an affidavit of service while you can simply just create an account if you don't have it, or log in and upload it and pay and remain in Kiambu and do other things.
Just one click away.
Yes. Yeah.
All right. So how has the uptake been with now the other stakeholders, the common mwananchi? I want my case to be heard. What she was talking about. How has the uptake been?
Okay, I'll work with statistics.
Right.
Since we started, that is around March last year, we've had an increased number of advocates actually creating accounts. About 15,000 have had an account.
Yes.
And these are people who practice in Nairobi.
Right.
Because e-filing is in Nairobi. And then the other stations that are outside we are still working on how we can roll out e-filing to them.
Okay.
Because you must be prepared in terms of scanning the files.
Right.
And then also there has to be a lot of equipment. Training has to be done.
Wow.
So, but for Nairobi courts, at least e-filing is there. Most of our litigants and advocates are able to file at the comfort of their offices.
Right.
The other thing is, like my colleague has rightfully said, it has saved a lot of time, queue management, because right now we are not seeing a lot of people coming in to our courts.
Right.
In as much as it has reduced the people, the brokers, we used to call them brokers.
Oh, brokers,
yeah. But right now, at least we are seeing some of the services are being, at least people are inquiring more.
Right.
The other thing is from this, we can see even the advocates. We've partnered with Law Society of Kenya, Nairobi branch. So from time to time, we have courses that are able to, the advocates are able to come here and enroll and get the CPD points from it. So that is also encouraging on their part.
All right.
It's not for them to just come and hear and listen in.
Right.
So it's also an encouraging in terms of professional development.
All right.
Yes.
All right. Dr. are you still with us?
Yeah.
All right. So Joannick has a question for you.
There's something you mentioned about the teen vaccination that was proposed. There was a rollout for the teenagers to be vaccinated.
Yeah, teen vaccination.
Yes. So do you feel like it's going to be effective, and is it something that you'd encourage the parents to give their consent for the kids to also get their vaccination in a bid to beat COVID-19?
Excuse me, sorry, can you repeat the question?
I'm asking in regards to the teen vaccination.
Right.
Is it something that you would encourage from your medical perspective to encourage the parents to give their consent for the children to get vaccinated as well?
Yeah, I think it is the right time to do that, because now you see children also can get COVID. It's not that the children are spared from COVID. And sometimes they are the carriers. We don't know whether they are the carriers or not. They remain asymptomatic. So the best thing is that it's a right move for children to be started vaccinated. In fact, in Western Europe and European countries, they start vaccinating children from the age of 5.
Right.
So I think it's quite a safe thing, and it should have been done a long time ago. As soon as the Western countries started, we should have done, but we are a bit late, but it's now better late than never. I think it's the right thing, but consent has to be taken because they are still underage.
All right.
The parents, if they agree, then the vaccination will be given. If not, but I'm sure the parents will not refuse because the way the pandemic is around, and I'm sure the parents must have also been vaccinated. Ready, so I'm sure they will not refuse for the children to be vaccinated.
Okay.
And it's next year, and before vaccination, there will be education to the children. There will be awareness created within the schools among the children.
All right. Oh, that's...
The children will be informed the parents about it.
Right.
So consent has to be taken.
All right. Daktari, yes. Maybe one question for you before we take a break to do the news, and then we'll be back in the next hour. What are your thoughts on COVID-19? Because everyone believes that this pandemic is with us. We're going to live with it as the way we've lived with the flu, etc. What are your thoughts and your remarks on therapy and treatment, and also living with COVID-19 in our society?
Now, this COVID-19 is a global pandemic.
Right.
It is not going to go off unless we have mass vaccination all over the world.
Yes.
And equity is involved in it, where vaccines are given to the poor countries as well. What happens now, there is unequal distribution, supply of the vaccine. So generally, to avoid this pandemic, we have to have the mass vaccination done. If we can't do that, then the only thing we have to do is, instead of surviving, we have to live with the COVID infection.
Wow.
And as time goes by, the severity of the infection of COVID goes down, you see. But the best way to combat this pandemic is to have mass vaccination. Vaccination is very, very safe, effective. But the only problem is there is unequal distribution, because poor countries don't get enough. Now, as far as statistics are concerned, almost 75% of the population in high-income countries have already been vaccinated. In poor countries, it's about 1%. And whereas in the Western countries, in those high-income countries, they already started thinking of giving a booster dose. But the poor countries are still lacking supply of vaccines. So if there is an equal distribution, this pandemic can be controlled in a very short period of time.
All right.
But if it is not, then we have to either live with it, either survive. Before we were trying to survive, now we may have to just live with it.
All right. All right.
They are not supplied equally to poor countries also.
Right. All right, Daktari, we're going to come back in the next hour and talk about the vaccine equity and which organizations are actually pushing for equity across all nations, as well as, are we in plans to make our own vaccine locally? And we're going to discuss all about that. We have Dr. Zainab SG, Martin Jagongo, Yvonne Kinya Mbai in studio. We are all talking about the digitization of the judiciary as well as COVID-19 vaccine equity.
And of course, the conversation continues. Any questions? 0701 969 969.
All right, we have Daktari. Are you there?
Yeah, hello.
Hello, how are you doing?
Fine, but I'm already back to work now.
All right, so
we can always talk over the phone.
All right. So what to, just because of that, we want to release you because, you are quite a busy person, and we want to say thank you first and foremost for taking your time. But what would be your closing remarks today when matters COVID?
I already gave my closing remarks. Okay, anyway, I can give you just now also.
Right.
I think the vaccines are quite very safe and effective.
Right.
And to get that vaccine to the level of mass vaccination in Kenya, where only about fully vaccinated people population is around 4.5%. To come up with a full vaccination, we need to educate, bring counseling, media publicity, all those things, and people, so that people get aware of it. They will have to desensitize them from their apathy and from hesitancy.
Right.
And that's the only way we will be able to combat this COVID-19. And if we are not able to combat it, then we have to live with it. Like the way we live with other diseases like HIV.
Wow.
We get used to it, and that's it. That's my closing remark.
All right.
But vaccines are quite safe,
Yes.
and it's quite safe to take it and effective, and there are very, very minimum side effects to that.
Right. Thank you so much,
Yes.
Daktari. Thank you
You're
for your
welcome.
time. Have a great day. Thank
I
you.
hope I have been quite productive
Almost.
for giving you the information what was required.
Most definitely. We are really appreciative of that.
No, you're welcome. Thank you so much.
All right.
Asante. All right. That was Dr. Zainab SAG, who's a general medical practitioner and lawyer. So, doctor by day, lawyer by night.
I don't know if there's a particular reason why she chose that order, or it's just life.
Maybe, Martin, you've worked with the
Is it
Asian
that
community.
most legal matters are well dealt in the afternoon? Or
It's a good mix.
Yes.
And
But it's let's be honest.
Yeah.
It's not your normal mix.
Yeah.
You get like doctor and lawyer. Those
Yes.
two were silos when you were growing
Yeah,
up.
yeah.
You either become a doctor, a lawyer, an engineer,
pilot.
pilot, and then
Yeah,
the one they
yeah.
just bring it. You are a teacher.
Because
So that one there.
they are both full-time and
Yes.
they are engaging
Demanding.
Yes.
and demanding a
Yes.
lot.
So have you seen this a lot in the Asian community because you've worked with them?
Well, I have seen about two. I think there's another advocate that I know in
Right.
Nairobi.
Wow.
Now I'm hearing about this one.
Yes.
Who has done both, and it's usually good for there's medical legal.
Yes, there's a correlation.
There's a place they interact.
Right.
And especially there's an NGO that deals with medical and legal issues. Like most issues to do with FGM are both
yes.
medical and legal, and issues to do with also reproductive rights.
Yes. Malpractice is there as well.
Yes.
Yes.
A lot. It cuts across malpractice and all that. So it's such a good mix, but it's no mean feat.
It's not.
It takes a lot of
only the
dedication.
strong.
Yeah.
Sisi kama packages za computers zinatusumbua. You can imagine trying to do both. But it's so good to have you, as in your time. It's been amazing having you here. But what are some of the closing remarks that we should think about in matters digitization of the judiciary where it's concerned?
Okay.
Yes.
Fine. Just parting short is to let people know that we've not closed courts. Courts are still open.
Right.
And we have instances where cases will not really go virtual.
Oh, yes.
There's also an option of an open city.
Right.
So we are embracing a hybrid sort of system whereby for criminal cases mostly we'll prefer in person.
Right.
For civil, at least most of the things are done procedurally, so
Right.
that one at least it can go through the virtual session. Also, for you to get requests for dates for your cases,
Right.
there's an USSD that we have.
A short code.
Yes, star 508
Star
hash.
508 hash.
Yes, and then it will prompt you.
Yes.
You can even request for dates for
Wow.
your case, get to know the case activities and what have you.
But this is after cases have been filed.
Yes, the
and you
cases
want
that
to
are ongoing.
ongoing.
Yes.
So star 508 hash is the USSD short code that you need to dial to get the your court dates.
Yes.
It will give you prompts and you'll follow the prompts.
Case activities,
Right.
request for further dates, for hearing, what have you.
Hi, we have public, before we come to Martin, we have public information from the judiciary where someone as simple as Duncan and Joannick can access these cases. So where can we access them, and do we even have the right to access some cases, maybe cases from the past, maybe to refer etc?
There are cases that are private.
Right.
Children cases are private.
Children cases are private.
Yes. But we have the e-filing portal,
Right.
where we have the public information kiosk. When you click there, it will prompt you. You can now select in which particular court,
Category.
in which particular case type, which particular case. You must know the case.
Yes.
For you to be able to see all that. Also for family cases, that is for the succession matters.
Right.
At times you might be wondering, somebody has passed on, but you'll want to see if there's somebody else who has filed it somewhere else.
Aha.
Also on the e-filing portal, you are going there, you can just click there and then go to the P&A matters.
P&A.
Yes, P&A. That is probate and administration matters.
That's right. Okay.
Once you click there, you write the name of the deceased.
Right.
And then it will give you, if that case has been filed anywhere else, you can always know.
Wow.
Yeah.
Wow, that's such amazing.
It's interesting, very interesting.
All this information is on the website, the portal. Martin, what is that portal again? Maybe we can visit.
Well, it's simple. You just type e-filing.
E-filing.
E-filing. If you search e-filing Kenya,
it will bring all the websites.
It will give you. So when you click there, there's a public information kiosk like Yvonne has just said,
right,
which is very easy to use. I have very little knowledge in ICT and the navigation of those things.
Right.
But I found it so easy to use because you can search any court countrywide. It's called Public Information Kiosk. But we are also concerned that there are guys who look at computers and they want to stand far away from it. Yeah, and there are people who are illiterate. There are people who, I'm thinking about my village deep in Rarieda constituency.
Yes.
Someone has been charged in Bondo Law Courts. It's the nearest court.
Right.
And you're telling them to look at this. I mean, what we have done in every court station, now that we have additional ICT officers, in every court station we are going to have a support desk. And just to touch a bit on the project that the Chief Justice is currently working on.
Right.
Her vision is on social transformation through
right.
access to justice.
That's right.
And she has looked at our constitution in a different way. She looks at the constitution as a social document, because the constitution, this current constitution that we have, does not just prescribe the government and the powers the government may have. It also gives a lot of rights and several other issues on family, on touching on the social aspects. So the Chief Justice is saying that she wants to realize these social edicts in the Constitution through access to justice. So she focuses more on partnering with other government arms and partners. Right. So there's a plan in place currently to have the Huduma centers, which are already in place. Right. Because we cannot initiate. It would be expensive. It's a good concept. Yes. So the judiciary wants to ride on it. Right. And have kiosks and desks so that at Huduma centers. Wow. So that the person, the Otieno that I have in mind from Rarieda goes there and gets the information that they want, or simply using their small phone can do that, dial the star 508 if they have a case in, for example, Bondo Law Courts, and they are good to go. Wow. So it's access to justice, access to justice, access to justice.
With all respect to
digitization.
To the new Chief Justice, is she planning to partner with the Fourth Estate in educating the masses in matters judiciary?
Yes. The current Chief Justice is very open to media engagement.
Very good.
She is.
So when is she coming here? Oh, sorry. Continue.
In a very unprecedented manner. Right. You have seen judges. You have seen various officers in the judiciary appear in radio stations and TV stations. Right. To explain certain things. Right. It has not happened before. So we have, in that regard, we have Justice Thursdays. Maybe Yvonne can add something on it.
Tell us about Justice Thursdays.
So Justice Thursdays is whereby we as the court, who presumably were very close, we could not talk. People would see judiciary at the gate and then they're like, oh, if I go there, I'll be jailed. Right now, we are open. Yes. The processes are simple. Right. So in Justice Thursdays, like this week, we'll be having some of the judges talk about mediation, the alternative justice system. Right. We also have the children's rights. Right. November has been dedicated as the month where we are clearing backlog in the children courts.
Children. Oh, okay.
So you'll find many of the times we'll have most of the courts giving us initiatives for service weeks. So I know like this week we have Tononoka and Kisumu. The magistrates are working on to clear the backlogs out there. Okay. So on this Justice Thursday, like tomorrow, we'll be having the judge come in to talk about children's rights.
Wow.
What things we've done in our courts. In relation to, you see, virtual hearings is also another thing.
Yes.
And
yes.
A child should not actually see the accused.
Oh.
That is how it is.
Wow.
Because at times, you see, you will find the child not giving the evidence that is required. So with this, we'll try to explain the processes that are working, what we've done as judiciary, and what more plans we have in place.
Wow.
Yes.
That is amazing. That is so amazing.
I think this information is very important because, again, you know, we've always known as judiciary to be, you know,
Niwale.
tunawachanga huko.
Yes.
You know, we don't want to touch them. We don't want to.
Exactly.
But I think at least the fact that you know that the information is accessible and that there's nothing wrong with trying to access this information and just to know, because again, you get to know for yourself and you know how it helps you, that information helps you. So I think it's this is a conversation that needs to you know, to proceed and to go on so that we get to capture a lot of people and just try and change the mindset that digitization simply means that the information is closer home than it has ever been before.
It is accessible.
It is.
And also, you know, the common mwananchi, how to conduct yourself in court. We want to bring you back so that we can talk about what is the court, you know, how do I conduct myself in the court? How accessible is the justice system to me, the common mwananchi? Si kungojea tu, because we're finding people as young as 24, 23 on the dock answering to cases and they don't even know how, judge, unajua, you know, is that how you talk to the judge? How do you conduct yourselves?
Yes.
Probably we'll bring you back and have, you know, you explain to us and help us. To demystify the judiciary. Yes, that would be very nice. All right, thank you so much for your time, Yvonne and Martin. Karibuni sana. I don't know whether you have shout outs. Kuna watu wanawasikiza. You know, guys in their office, they have tuned in. They are listening. They're like, "Huyo ni mtu wetu." You know, maybe you can send shout outs pole pole as we finish. Yes.
Okay, my salams to all my colleagues back at Milimani, and also all the colleagues back in all the courts that are listening in.
Okay, so we can walk into Milimani not only because that we can come and have a cup of coffee, because that section of community is very scary.
You're welcome.
Right
now, I have very dedicated colleagues. Right now, I know they are busy, but they have found time to listen to me. I'm sure. So I pass my regards. And also, I also told my wife I would be appearing on radio today. Jackie Owiti, and I'm sure she has tuned in from wherever she is. I wish my son was also there. He's in school.
Okay.
But hi to them.
Fantastic. That's amazing. So we are going to send anyone that is listening on our social media pages, because we are going to take fantastic photos with this team, but we're obviously going to have you back. Thank you so much on behalf of PAL Radio and its listeners, my fans. I know they were just drafting questions here, but you know, we had so much information. But next time we're going to segment it and have have more questions from the listeners, and then we're going to effect that kabisa.
Join Tina and Zuki and Danko on Pearl in the Morning.
Weekdays from 5:30 a.m. to 10 a.m.